If you all could, go ahead and stand.
Another important is during the second call, you got your audio set. So I got live audio monitoring to make sure.
Good afternoon, everybody. Today is an exciting day. It's another in a series of announcements that we're making about the ways we're working to make our city safer, stronger, and healthier. And another action we're taking to make reforms and improvements to the Louisville Metro Police Department. Today's announcement is aligned with the recommendations of the recent United States Department of Justice report. We're not waiting. We're taking action. Today's announcement improves how LMPD works with the community to improve public safety. One key to doing that is making sure that we send our police officers into situations where they have the training and resources to provide the most help. For example, when a crime is being committed or has been committed, those are clearly situations where our police should be dispatched, so they can do what's needed to protect and serve victims and make arrests as needed under the law. In reality, all too often, police officers are sent into situations that are not really about law enforcement. Over and over, we've seen situations where our MetroSafe 911 dispatch center receives calls from people or about people who are in distress. Sometimes when police officers respond to these calls, it becomes clear that what those individuals need really isn't a police officer. They need a social worker. They need a trained mental health professional who can help with problem solving, de-escalation, and possibly make referrals to appropriate community services. That's why Metro Council approved the launch of a pilot program known as the Crisis Call Diversion Program in 2022. We also refer to it as the Deflection Program. This started as a pilot program in LMPD's 4th Division, and it's a partnership with 7 county services and others, including the University of Louisville. Let me just give you a brief explanation of how the Deflection Program works. First, someone calls 911. Our MetroSafe call takers initially do triage to determine if the call is a violent crime emergency, for example, or whether it should be transferred to crisis triage workers in the behavioral health hub within MetroSafe. The crisis triage workers, who are 7 counties' employees, function like a crisis hotline staff. They de-escalate, provide emotional support, create a safety plan, and problem solve for the person in crisis. Gene from 7 counties will tell you more about how deflection works in a minute, but the most important thing to know is that it does work. This program works very well. It gets people the right help at the right time, and it saves police resources so that our officers can focus on preventing violent crime. The program started in the 4th Division. That's because that division has a very high number of crisis intervention-related calls, more than 4,000 calls per year. The results were so positive, it was expanded to some other divisions, and word has gotten out. Our team has now seen people call 911 who say, "I don't need the police. I don't need emergency services. I want to talk to somebody from Deflection." Since its launch, Deflection has fielded about 1,200 calls, and our crisis triage team has spent nearly 300 hours on the phone de-escalating callers in distress and getting them to the point where no one is needed to respond in person. They've helped over 600 people resolve crisis support and referrals without the involvement of LMPD officers. That has saved our officers nearly 350 hours they might otherwise have spent on those calls. As we celebrate the 1-year anniversary today of this program, I'm really proud to announce today that we at Metro Government are expanding the Deflection Program citywide. It will now be available in all 8 divisions. This will allow people throughout our city who are served by LMPD to have access to this extremely valuable resources. This expansion has been in the works for a while, and it also aligns with the reforms laid out by the United States Department of Justice report. In fact, expanding the deflection program to all divisions was the specific recommendation of the DOJ, which called for us to deploy alternative resources. I'll read directly from page 67 of the DOJ report, which references deflection. Quote, "The pilot program is a significant start, and Louisville Metro could expand its reach and capacity for a behavioral health-led response to further prevent discrimination against people with behavioral health disabilities." End quote. That's directly from the DOJ report. And that's exactly what we are taking action to do. We are not waiting. We are moving full steam ahead. This expansion is a great step forward. There'll be many more to come over the coming weeks and months. And we're proud to celebrate the success of this program and continue to develop this program, which helps us serve the people of Louisville. I want to thank Deputy Mayor David James, Jody Myman, and all of our MetroSafe team for the work they're taking every day to make this program a success. I also want to thank our interim chief, Jacqueline Gwynn Villaroel, and her entire team at LMPD for their effort in supporting this program. And I want to thank our partners on Metro Council for their initial support of this program and what I hope is their continued support. We're joined here today by several Metro Council members, including our newest Metro Council member, Ben Reno-Weber, who is in particular passionate about continuing to expand this program. And so we're excited to work together with Metro Council on ways that we can continue to support this, support 7 counties and U of L Health as they need more resources to continue to roll this out. So next, let's hear from one of those partners, Jean Romano, representing 7 counties. Jean?
I'm Jean Romano with 7 counties, and we're very excited to be part of this partnership with MetroSafe, LMPD, and the city to be able to provide this service to individuals in our community who are experiencing a mental health crisis. When someone does call 911 or MetroSafe, if they meet criteria, they'll be transferred to our crisis triage workers who function just like our crisis line workers. They can talk with the individual, get more information about the crisis, really kind of determine what is needed. Sometimes it's linking them to resources that they may not be aware of in the community. If it's needed, they can actually dispatch the mobile crisis response team who can go out and meet with someone individually in the community and continue that de-escalation, determine what resources are needed, and then help provide them that resource and support to access. Many individuals often think that the hospital is their path, but we know that Louisville has many other resources and lower level of cares, and we're going to try and help people connect to all of the possibilities in the community, as well as their natural supports. Each individual also has contact with a case manager who can then follow up and be able to provide those linkage so that they don't find themselves in a crisis anymore. We're really excited, again, to celebrate the 1-year milestone. One example that I often share with individuals when we talk about deflection, very early on in the program, we had a gentleman who was calling 911 reporting that he was hearing gunshots. But in actuality, it was a trauma response, a PTSD response, and police had already been out. Deflection was able to get involved and talk about resources with him and get him connected to a family member who was a safe place for him to stay. And so that was an example of the police weren't needed. He didn't have to go to a hospital. He was able to use his natural supports, and we were able to help get him an appointment a little bit sooner with the VA where he was already an established patient. So that's a perfect example of how this program works. So thank you.
Thank you so much, Jean. One of the important things also to know is that this is about money. It's also about people. Metro Councilman Kumar, Reno-Weber, I know that in the coming months we're going to be dealing with the budget. And our administration is going to continue to support providing even more funds to expand the deflection program. Now that it's citywide, it's operating between 2 p.m. and 10 p.m. to expand the hours, and hopefully you all will support that as well. But one of the other things that we need help with is people. It's not just about money. And so if you are interested in helping others, if you are interested in a new career that can make a difference for people who are having challenging times and are in distress, please reach out to 7 counties. They're hiring. They're looking for people that either have degrees or can be trained to become mental health professionals to serve our community in need. So I encourage people who are thinking about helping others to reach out to 7 counties for a new career opportunity. Another one of our big partners in this is LMPD. So now let's hear from Sergeant Pam Oberhausen, who's going to talk about what this program has meant to LMPD and its officers. Sergeant?
Hello, appreciate being here for sure. Again, Pam Oberhausen. The deflection program is a great program. The bottom line is, hands down, it's a wonderful program. We don't always see on LMPD like the back stories of a lot of these things and these situations, but we have a close team and are very close, myself and Jean and LMPD. We work very, very well together with each other. We're still a team in all of this. Deflection is part of our team. So that's the most important thing. And we are really, really trying to make sure that our mental health community gets the treatment that they deserve. So I'm just going to share the first story of my very first deflection run, which is it lined up exactly how it is supposed to be and how it's supposed to work and what it did for all of us. I had a female who was suffering from PTSD, was on the phone with the insurance, couldn't get medication, was having a struggle. They called us because she had barricaded herself in the apartment. By the time we got to her apartment, she opened up right away for us and had talked to us and told us everything that was going on, which made perfect sense why she barricaded her apartment, bottom line. She was in an episode, and it completely aligned with what was going on. We called deflection, and we'd already been out there for a little bit, and called deflection. Deflection called her on the phone, and then they ended up setting up services with her. She already had a therapist and things like that. This is my very first run, and I've been on a long time, and I've been with CIT from the beginning, which is still out there and still a very strong program, and we still go out there and help a whole lot of people. I would have stayed on this run forever as needed, but the problem is now I need to pass it on to the people who can help even more. I was struggling when I did that, because that's my very first run I left, where I left somebody. So as I'm going back to the division, and I'm thinking, okay, get yourself together, Pam. A holdup comes out, and it's a robbery at a business. The guy was armed with a gun. My officers get there right away, foot chase, things like that. Now I'm, as a patrol sergeant, am responsible for making the scene of that robbery and making sure everything's done okay. So because of that, I was able to go to the robbery and not be on that run that I would have any other time have stayed on as long as I needed to, but I needed to pass that on to more, the people who could help her better than me. And that's how that worked out. And that was the very first run I ever made. So that just goes to say in line with what this program does and how beneficial it is to the people who suffer in this community from behavioral health issues. And it's just invaluable to giving them another resource, because we'll still be out there making runs and spending the time we need. But it's an invaluable resource to help people. It's that extra tool, and these guys are the experts. These guys are the pros. These guys have all the resources, and it's all about helping our community who needs help. That's it. So, thank you.
Thank you so much, Sergeant Oberhausen. And finally, the University of Louisville has been a very important partner in this whole work. The deflection program follows recommendations made by U of L Commonwealth Institute of Kentucky, and we're working with the university to study how deflection has been working and its impact on the community. So to talk about that work, here's Dean Craig Blakely, who's Dean of the School of Public Health and Information Sciences at U of L. Dean Blakely?
Great to be here today, celebrating this one-year anniversary and looking forward to where this project heads down the road from here. I remember nearly 2 years ago when a handful of us were having initial conversations about that. David James, Barbara Sexton-Smith, Abby Drain from 7 County Services, sort of talking about this idea. There have been a few cities that are a little down the road ahead of us on this, and we were thinking, post Breonna Taylor, there's a lot of things going on in the city. This would be something we should look at. And so we got engaged with Metro Safe and Kelly and Jody and folks from the police department and started having more detailed conversations and actually went out and looked at some of the other programs around the country and kind of created our own spin-off of some of these ideas. We in academic public health are all about trying to create conditions under which people can be healthy. And so generally that means you point toward policy change and changing program service access kinds of issues. And this is a perfect example of that. And academic public health is only as useful as the partnerships that we build with folks like the city, with partners like 7 County Services. And this is a perfect illustration of the successes that can be achieved by those collaborations. We're really excited to see where this is going. The project at the university now is run by Dr. Brian Schaefer, who is here in the back of the room. Our role has emerged from being part of the conceptual team to now we're doing the sort of independent evaluation, trying to generate the information that documents for council that, in fact, this is a good investment. And we're confident that we'll be able to do that. So anyway, this is a great illustration of a university working with community and city partners for the good of the population. And as you've heard from my colleagues, all the evidence points toward some real positive outcomes at the individual level, and it's because of the collective work that we're doing. So thank you for the leadership. Look forward to seeing the next year of progress. Thank you.
Thank you very much, Dean Blakely, and thank you to all of our partners at U of L, at 7 counties, at LMPD. We're excited to continue to expand this program, to celebrate future anniversaries, and working with our partners on Metro Council, continuing to expand this program and support it throughout the entire city to better serve our community. Thank you all very much, and happy to take any questions from the media if you all have any.
Mayor, how is this expansion being funded by the city?
So we did have funds available to do this expansion based on the volume and the resources that Jody and his team at MetroSafe had in the existing budget. And then we will plan for next year's budget as we look to expand some hours. That will take additional resources that we'll be looking at in that budget proposal. And again, some of it is a 7 counties issue with how many people they have on their team to be able to respond. Even if we have the people taking the calls, we need to have enough mental health professionals who are available to respond as well.
Will you be asking for an expanded funding in your budget proposal for this program?
We will be, yes.
You might have hinted at this when you made a pitch for additional employees. Are there plans to expand this to a 24/7 operation, and what is that going to take?
I think eventually we'd all like to get there. And so I think it's incremental steps to get there. And so we have started discussions with 7 counties about, given just the limitation on mental health professionals in the community, what is a realistic timetable to continue to expand it, where the hours of need are the most. 2 to 10 is where the professionals from LMPD and 7 counties have identified to date that are the hours we most need it, what are the next most needed hours, and that's how we'll continue expanding it. The goal is to eventually be 24/7, but I don't think that'll take a little bit of time to grow into as we recruit more folks to join the team.
Is there a dollar amount that you can share right now in terms of how much this is costing to expand to all divisions?
Not yet. We'll have that when we make our budget proposal to Metro Council.
Can you clarify, this one to effect like this week or last week, earlier this month, that it reached all the divisions?
I think it's today, right, Joe? Yeah, today.
Gotcha. And then for Sergeant or Gene, what examples are there still out there? Maybe challenges that you're still having, like things that maybe it takes a bit to figure out with this program, given that people obviously have a wide variety of issues that they're dealing with?
Sure. So again, across Louisville and even the Commonwealth, we are dealing with a shortage of healthcare workers. So sometimes we have someone who may need that higher level of care, and our community partners are also dealing with staffing issues, so they might be on a diversion themselves. So support for mental health across the Commonwealth is going to help this and future programs like it succeed.
I know that you all take several steps to de-escalate the situation when you're on the phone. Have any mental health professionals ever felt threatened at the scene, and how was that handled if so?
We've not had any instances where staff have been in significant safety issues. The team focuses on safety. They have code words that they use if they don't feel safe, and we trust each other that if it's not a safe situation, we will step back and allow others to handle.
Could you elaborate on the difficulty in getting enough social workers to do your job and maybe how that might have slowed your progress so far?
Really, we are looking for individuals who have skills in de-escalation, so they may not necessarily be licensed social workers, licensed counselors. They have experience staying calm in a crisis. So we're hoping to cast that broad net of individuals who might see this as a career path.
Question for the representative from U of L. I know that there's already been a report that was issued about evaluating the pilot program. What kind of ongoing analysis are U of L researchers going to do about this program?
Yeah, thank you. There was a report last June that is out and publicly available. There's an interim report that went in that was delivered to the city in January that should be publicly available soon, and there'll be another report that will be the end of this year in June. So we're actually looking at issues related to productivity in the clinical setting, if you will. We're looking at the economics of the situation in terms of, the resource spend for social services, behavioral health services relative to a police response. And so there's a magnitude of things that we're looking at to try and basically make the case that the outcomes are better and the costs are still supportive of this investment. And I think one other thing I'd mention is as we've worked from one division to now 8 divisions, we're now focused on 2 until 10 p.m., which is, we looked at the data on when calls come in, and that's where the volume is. And so we'll look at the data some more and begin picking away at expanding those hours a little bit on either end of that, depending upon, when that makes sense. But I think there's also an opportunity to expand services, looking at where you draw the line on the triage and what portion of the call volume end up being triaged. And so you start out conservative, obviously, and as you've heard, we've really not had too many problems yet. And so there's probably room for some expansion that way as well. So there's lots of room to expand these services. I hope I answered your question.
A question for Deputy Mayor James. Since you've been involved in this from the beginning, the report that was just mentioned that came out in June emphasized the need for a long-term commitment from the city. Could you articulate what sort of commitment the city's making to it in terms of time frame?
Well, I think you just heard the mayor say that he's going to be asking the Metro Council for funding for that for this next upcoming year. So that, as you know, we go from fiscal year to fiscal year. So the mayor's just announced that he plans to ask the Metro Council to be able to do that. I hope that answered your question.
I guess so. Maybe if you could elaborate a little bit about the need for a long-term commitment to this. You had a pilot project. Apparently that wasn't enough. You're still growing.
Yes, we're still growing. We're still expanding. In the best of all worlds, we'd be operating 24 hours a day, 7 days a week throughout the entire county because we feel like this program is working. And so in order to continue to do that, we will need funding for that. And that'll be coming forward with the mayor's budget proposal. There it is. And the help of the Metro Council in order to do so. Thank you.
What do you think with a full expansion of this? What does success look like for this program? How does everybody in the city see the benefits to this?
I think success will come in many ways. You've heard about 2 examples today, one from LMPD, one from 7 counties, about examples where this program has helped individuals in need that really were able to benefit more from a behavioral health professional versus traditional policing or police officer responsibilities. And you also heard about how by having these additional mental health professionals available to respond to people in distress, it frees up our police officers to focus on reducing the amount of violent crime in our city. And so as we have more examples of this, to me, that's success. We measure it one person at a time. People that we're helping as a result of calling 911 and getting a response, whether it's in person or on the phone, that helps them through their time of crisis. Thank you all very much.
Good to see you. Smack David around a little bit. Tell him that was a great sign. Yeah, we are. How you doing? Enjoying the job? Good.